Let's talk about HCM. HCM, or hypertrophic cardiomyopathy, is an inherited heart disease that causes an abnormal and progressive thickening of the heart muscle in cats. This mostly affects the left ventricular wall. This leads to an increased stiffness of the wall, and it impacts heart function in a severe manner. During the filling phase of the cardiac cycle, the thick and stiffened left ventricular wall is unable to fulfill its function and to relax. As a result, there is an increased pressure that builds up within this ventricle, and this in turn causes a backup of blood flowing back into the lungs. Compromised heart function can lead to a number of life-threatening complications such as respiratory distress, clot formation, sudden onset paralysis, and congestive heart failure. And the severity of these complications cannot be emphasized enough. For example, HCM has been associated with a high prevalence of thromboembolic events. Thromboembolism in HCM is a life-threatening condition in which a blood clot or a thrombus develops inside the upper chamber of the heart. This clot then breaks down. It can migrate into the circulation and obstruct blood flow in other parts of the body. The consequences of this, as you can imagine, are devastating. Not every cat with HCM will develop a clot, but it is a very real risk. In most cases, a thromboembolic episode can cause an acute and very painful paralysis, commonly affecting the hind limbs. Many HCM-afflicted cats may not show typical signs of illness, which means that sadly, cat parents will only notice when critical consequences such as shock or paralysis become evident. As a result, we have many cats with HCM that are rushed to us as critical emergencies. The best way to properly assess and monitor hypertrophied heart muscle is through high-quality echocardiographic imaging. There is a staging process, and treatment decisions are based on the stage of the disease. This is also why annual screening exams are so important, as veterinarians can track how the disease is progressing over time and adjust treatment accordingly. There are a number of HCM mimicking diseases that may have all the characteristics of HCM but might be caused by other environmental or genetic conditions. These conditions and diseases need to be addressed and ruled out by an experienced veterinarian. This is why regular cardiac screening is absolutely essential. The risk of HCM developing increases over time and age, and we recommend annual screening exams for cats of all breeds and ages. We do receive a number of critical emergencies arising from cardiac and cardiac-related disease. However, we want cat parents to know that an HCM diagnosis is not a death sentence. Depending on the stage of the disease, with proper management and regular cardiac screenings, HCM can be managed. Many of our beloved patients have gone on to lead a good quality
Hypertrophic cardiomyopathy, or HCM, is a disease where the heart muscle becomes abnormally thick and stiff, making it harder for the heart to pump blood. In HCM, there are too many connections or cross bridges between actin and myosin proteins, which produces excess work and makes it harder for the muscle to relax. Common symptoms of HCM include shortness of breath, palpitations, chest pain, lightheadedness, fainting, and fatigue. Mavacamten is a once-a-day oral investigational therapy for obstructive HCM. Mavacamten targets the underlying mechanism of HCM by inhibiting and therefore reducing the number of actin-myosin cross-bridges. It improves how the heart relaxes and fills with blood, reduces how hard it works to pump, and reduces how much energy is used for each heartbeat. The Explorer HCM study compared mavacamten treatment to a placebo in people with symptomatic obstructive HCM. Results showed that, compared to placebo, mavacamten improved heart function by decreasing obstruction of blood flow to the body. Mavacamten improved symptoms and how people felt about their overall health. It also improved exercise capacity and reduced biomarkers of heart wall stress and injury. These are promising results for people with HCM, and mavacamten's side effects were generally mild and similar to placebo.